Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron, and I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to prime health in life and in business. Today's episode is going to be fantastic, and you will learn why so many people do everything right and still don't feel good in their body. My guest today, Dr. Michelle Pearlman, the CEO and co-founder of Prime Institute and Byte MD, challenges that idea completely. We talk about health that shows up in your energy, your confidence, and your intimacy, not just in your lab work. And I'm excited, just like you are, to hear what she has to say. Before we jump into this episode, just a quick message from our sponsor, Growth Solutions, where we believe brilliant healthcare professionals shouldn't have to choose between patient care and practice growth. We handle the business growth side so you can focus on what you do best. And Growth Solutions can eliminate stressors in the business, such as new patient or client acquisitions, marketing and growth strategies, reducing operational chaos with proven systems, frameworks, and SOPs. And yes, we help you with those nasty AI and AI bots that are coming, whether we like them or not. So Growth Solutions is not just an agency or vendor, we are your growth partner. So if you've ever thought this, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your growth solution. Just drop the word grow in below, or feel free to reach out to me on any social platform. But you're here for a reason today, and that's to hear our amazing guest, Dr. Pearlman. Dr. Pearlman, welcome to the Prime Health Podcast, and please tell us a little bit about yourself and what you do.
Derek, thank you so much for having me. So I need to put that little code in the chat here because that's actually something that, my sister and I have been thinking about at Prime Institute is how to scale our business with, a very small team. So thank you for everything that you do to help small businesses. So I am a gastroenterologist. And, what's interesting is most of what I do on a day-to-day basis is actually talk about food. It's nutrition, it's gut health, it's hormones for perimenopause and beyond, and weight management. So love what I do. I have my own practice with my twin sister, and it's really about maximizing the time that we have on this earth.
Yeah, I love that. So you'll see a lot of physicians that will graduate into, if you wish, functional medicine. You were already in that. You were already having that conversation. That had to have been an easy transition for you to go in.
I just think it's interesting how we kind of call it functional medicine when in reality, it's all functional. In no way is structure and function ever separate. But one of the reasons why I became a gastroenterologist is I was fascinated with nutrition and with the intestines and how we digest and absorb our nutrients. But what's interesting is, in 14 years worth of medical training, it wasn't until my 14th year of training that I actually learned how to talk to someone about what they were eating and sit down with them and then give them, tangible tools that they could then implement to improve their overall health. So, as a gastroenterologist, we're trained as proceduralists. And when patients would wake up from their endoscopy, they'd say, "Doc, I'm having major reflux. What's wrong with me?" And the reality is the endoscopies are only looking for structural things. They're not looking for functional abnormalities. And that's what a lot of people suffer from, which is one of the reasons why I kind of went into what I do today is I wasn't able to give people a lot of the answers they were looking for in traditional medicine.
Yeah. And I can tell by what I've done research on you and even just the small conversations that we had that you've got passion and integrity in your business and you really do want to help patients. Not that others don't, but I can see and I can tell that that's what you want to do. So I want to jump back a little bit and realize, was there a moment in time in your life that said, you know what, I do want to choose my path and career, and that's in medicine. What was that moment, if there was one?
I was always more interested in the science, type classes, not so much of an artsy type of person. So I gravitated towards those things. I, in undergrad actually was a personal trainer kind of as a side thing. And so I, was always into nutrition and exercise more so for myself because it was my kind of stress release. So that's kind of how I coped with life stressors. So I was a personal trainer, then actually got into bodybuilding on the side, and I would do bodybuilding shows every couple of years just to kind of push myself to the limits. But I remember, having like med school board exams, and with high stress, I would eat a ton of candy, let's say after a board exam, right? Because that's just the dopamine release and we feel good. And so I would eat sweets and whatnot and cookies and whatever. And, it got to the point where I would actually wake up the next morning and my neck started hurting. And I was like, this is weird. My body actually, like, I don't feel well after eating like high fructose corn syrup. And so I finally kind of said to myself, I am tired of feeling sick and tired. Like, I don't know why I'm sore. I had this visceral response to processed food. And that's kind of the impetus for why I really delved into more on the nutrition side and gastroenterology, is I wanted to figure out why that was happening. And I've learned over the years that food, our gut is our largest immune organ, and the food that we put in our body and the chemicals has an immediate response on the cellular health, really in all of our cells in our body, specifically the gut. So that was kind of one of the reasons why I went into medicine, specifically gastroenterology.
Yeah. What's interesting, what you say that, Dr. Pearlman, is a lot of people, so as a chiropractor myself, I really didn't quite understand, even though they taught it to us, the gut body and gut brain correlation.
Yeah.
And then somebody said once to me, if you see somebody that has a reaction on their skin, you see that outward reaction, but you have no idea what it's doing to the gut lining because it's almost the same. Mm-hmm. And it seemed as though you had that that dopamine hit of when you were done, you were stressed, you wanted the candy relief, and you're realizing, I feel bad. So your body from the inside is saying, I feel bad. I'm going to give you hints that most people don't pay attention to. I'm glad you did. But others, see a reaction on their skin and don't realize it's really happening from the inside out, what you're putting in and probably what you're listening to and seeing as well.
Well, and it's our body trying to protect us. And I tell people all the time, obviously, if someone's having a symptom, we want to do our due diligence and make sure we're not missing anything. But oftentimes, scarfing down a pizza at 10 o'clock at night and then, having some alcohol with that and then going to bed, I'd have patients say, Doc, I'm having heartburn. I used to be able to eat this when I was 20. Why can't I eat this way anymore at 40? And I'm like, listen, your body's not 20 anymore, and your body becomes less tolerant of, honestly, the poison that we're exposing it to. So we do the appropriate workup. But at the end of the day, our nutrition and our exercise and everything else we expose our body to has to be very dynamic as we get older. What we can get away with when we're 20, we can't get away with decades later. That's for sure.
That is, and there are some that try and fight that, and they suffer a little bit longer through the weekend into Monday and Tuesday. Their work is affected, unfortunately. So I do want to talk about the app called Byte MD that you're talking about. I would be remiss if I didn't say or ask this question of you. And I have to be very careful as a man asking a woman this question. In the introduction, you talked about intimacy. Can you tell me how that sexual health has an impact in your current practice?
Yeah, it's interesting. So I don't specifically do the sexual wellness part, but I am in practice with my twin sister. So like I mentioned, I'm a gastroenterologist. My sister is a urologist, and she directed the men's health program at the University of Iowa for 5 years. And it was never our plan to actually be in practice together. But around, when COVID hit, things got very challenging within healthcare. I was not happy. I, would show up to work super anxious. There was just a lot going on and a lot in flux. Around, probably 2021, 2022, my sister and I we felt like we were always complaining about our job. Nothing against our respective universities. It was just, we were not happy. And we would see 10 people, we would see colleagues like 10 years our senior who also seemed miserable. And I was like, if I'm this unhappy, 4 years into my quote unquote dream job, what is the next 10 years going to look like? So it just so happens that around the same time, my sister and I were just like, you know what, we're tired of complaining about this and we're ready to do something about it. And if we wait 10 years, we're going to be too exhausted to take that huge leap. So in 2022, we both left our jobs, our very secure salary, started our own concierge practice in Coral Gables. And that's kind of where the story begins. And we never look back, but we're able to practice medicine the way we, think it should be done, and hopefully provide a lot more value.
Yeah. Well, I appreciate the fact that you had the courage to jump as an athlete. It was probably easier than most, but it's very interesting how you realize that I see these people 10 years my senior and they're not enjoying it. what is my life going to evolve like? I'm going to take that risk now, because with high risk now typically gives high rewards later, which I'm sure you're experiencing. You'll experience even more in that.
And I think just in general, healthcare, the system is not getting any better, right? If it were on a positive trajectory, then some people are going to kind of wait it out. Her and I were just like, this does not look good. We need to just make that shift now. Yeah. So my sister and I joined forces at Prime Institute. So you had asked about, how does intimacy come into the practice? So that's kind of her area of expertise. It's men's health and then sexual wellness for men and women. Now, what's interesting is we never thought that we would have like a mutual patient, right? The kind of way it was set up is she's a urologist. She's going to see her patients. I do nutrition and weight management. I'm going to see my patients. But what's fascinating is sometimes these things just come up in conversation, right? So for instance, I saw a patient today she's diabetic. She's on Ozempic. She's lost a bunch of weight. She's feeling great. Her husband has high libido and she's, they have discrepant libido. So she kind of brought up the conversation with me and she goes, my husband wants me to see your sister, because we got to figure out how we can kind of align in that way. And it's taking a toll on her well-being and how that affects her exercise and her mood and her nutrition. So I'm like, hey, perfect. So it's actually a great referral, a referral network, an internal referral network, because a lot of times when we create the safe space in medical care, these things will come up in conversation if we allow them to happen. And a lot of people just suffer silently.
Yeah. So, I mean, it's great to have that internal referral source, but and I want you to kind of explain to us what would be different, Dr. Pearlman. So you being a GI doc, if somebody goes to somebody that's at a hospital or maybe a clinical setting, how do you approach patients differently in your practice than the typical GI would?
Yeah. So a big part of it comes down to kind of three different things. One is access, right? So a lot of people are interested in getting healthcare. The problem is when they call a typical, healthcare clinic or hospital-based system, they're put on hold and then they're given an appointment, 3 months if they're lucky. Some of the, centers down here in Miami, you're waiting a year to see an endocrinologist for your diabetes. So you have to provide the access, because when someone is ready to have that conversation, they're ready now. 3 months from now, they may be on to the next thing, right? So you have to provide the access. You also have to provide time. So there are amazing healthcare providers out there, but in a typical healthcare system, you get 15 minutes with your provider. And if you're at a large academic institution, you're probably seeing the medical student first, then the fellow, and then kind of the main attending may walk in, say hi, and then they'll kind of sign off on the note and make sure, everything made sense. So you're kind of having to share your story 3 different times, but not actually seeing the person that you probably scheduled the appointment with. So time is really the big thing here. You could be the smartest provider. If you only have 15 minutes with a patient, oftentimes the patient leaves with more questions than when they came in. And then good follow through. So, you could also, provide the best consultation, but if someone can't get in for another 3 months to follow up, then oftentimes whatever glorious plan you came up with, a lot of things are going to get lost in translation. So those things are really critical. You're not going to see a lot of those things in the typical healthcare system because insurance won't pay for it. And there aren't enough providers and the access just isn't great for all the patients that need help. So at Prime Institute, we really offer all of those things. When you call us, we answer the phone, which is the first thing, right? You got to answer the phone when a patient calls. And we try to get people in within a couple of weeks. And, we don't necessarily advertise this, but we come in on Saturdays and sometimes Sundays to accommodate people's schedules. People travel from all over the world, or even just, coming from Broward. And if they want to miss traffic, we're definitely happy to accommodate those folks. And then really the initial consultation can last anywhere from an hour and a half. Sometimes my sister's in a room with a patient for 3 hours. It's interesting. A lot of people think men don't like to talk about their health. My sister, she's funny. She goes, honestly, when you provide them the stage and you create that safe place, she goes, sometimes I can't get these guys to shut up. So, time is obviously the critical factor. And then, so when I talk about like gut health or nutrition or weight management, it's a very comprehensive visit. So I'm talking about obviously way beyond just what medical problems do you have. What are you eating on a typical day? Okay, you're having coffee. What are you putting in the coffee? Are you using artificial sweeteners? Which one? What sort of milk? How often are you eating? What do your snacks look like? Are you stressed when you're eating? Are you eating while you're watching TV? I mean, there's so many nuanced questions when it comes to nutrition. What I've learned over the past few years is what is equally as important as what we eat is how we eat, how much we eat, how late we eat, how frequently we eat, how we feel when we're eating. So the dietary habits are very important. And then, it's all about just figuring out, and I ask my patients all the time, how would you define optimal health and wellness for yourself? And some people are kind of taken aback by that. Like, you don't have to have a problem or a diagnosis to sit in front of an expert and figure out how you can become even better. So it's really about health optimization, not just putting Band-Aids on bullet wounds.
Yeah. I like both those, health optimization and not putting Band-Aids on bullet wounds, because most people, the Band-Aid that they get is from the television they watched, a social media post that they saw. Not that all social media posts are bad, but there's some that are not good for us. And you hit it so strongly on the head about the time factor. It doesn't mean that physicians are not good in the other settings, but they are limited by the powers that be that pay their paycheck. You want to give the best, opportunity to your patients that come in to see you. So taking that additional time really helps, because now you get to know the whole picture on the patient, and you can help them, whether it's weight loss or whether it's, improving other aspects of their health. You can finally listen, press the flash. I always say, knee to knee, and hearing what they have to say. And that's half the battle of learning what they want to release out of their system.
Yeah. And I have patients that, will spend $5,000 for an executive health physical, right? Where they go through the gamut, they get their stress test, they get their DEXA, they do bioimpedance. And then, they get a letter in the mail saying, okay, you're pre-diabetic, continue a healthful diet. Like, that was literally verbatim what was in the letter for $5,000. So, I think there's obviously a lot of worth in doing diagnostic testing. I think that's really important for prevention. But also I think we can do better in the recommendation side. Like, everyone is different, and nutrition can be very simple if we say eat whole foods and eat plant-based and lean protein, but there's also a lot of nuances. So in someone who's struggling with chronic gastrointestinal issues, I can't just tell someone to eat more fiber, eat more broccoli and cauliflower, right? Or someone with Crohn's disease, just eat more fiber. That may give them a bowel obstruction, or it could give them massive diarrhea. So it just depends on the person. There's a lot of nuances, especially if someone has underlying gastrointestinal symptoms. And then with the GLP-1s, so that was kind of another impetus, is when I was at my prior institution, that's when the GLP-1s were first starting to come out. I didn't have the availability to see patients for 6 months for follow-up. So with these medications in particular, we have to be very responsible prescribers. And it wasn't good. It wasn't good enough if I would write a prescription for Wegovy and say, I'll see you back in 6 months. Good luck with everything. That's when you tend to run into issues with lean tissue loss and GI side effects. So it kind of all was like a perfect storm. It kind of all happened at once. But I would say the evolution in the weight management space was also a big impetus for me leaving, because the way that we prescribe these medications and offer care, there's a lot more hand-holding than it traditionally had or warranted.
And that's good. And again, I always believe when somebody is so forward thinking like yourself and your sister, the patients have no idea what diamond they have in you guys as providers, because of how much you care, how much you know, and the benefit of the long-term care of being with you as a patient.
Thank you.
Oh, you're welcome.
Yeah. And the nutrition too. Like, as a gastroenterologist, I could see 3 patients in an hour to talk about acid reflux and then sign them up for an endoscopy. When it comes to these nutrition discussions, there's a lot more nuances. So it just requires more time, more follow-up, more detail. I did not want to be a jack of all trades and a master of none. So being in practice, on my own, I can really create that niche for myself and figure out what sort of patients do I want to see, who can I help the most. And for more kind of general gastroenterology type things, I refer them to colleagues.
Okay. All right. Fantastic. So I do want to hit on this with Prime Institute. The association you have something called Byte MD, which is an app, a health program that you're working on. I'd love to learn more about.
Yeah. So in my clinical practice, the reality is the majority of people will never see me in clinic. So it's separately from Prime, but a partner who's also a gastroenterologist and we kind of got together and said, how can we take our expertise and help more of the masses? And my colleague in this business, he's a gastroenterologist at Gastro Health. He sees anywhere from 30 to 35 patients in a day. So literally, bam, 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 10, 15-minute visits. Like, there's no way you can open up Pandora's box when it comes to nutrition. And we know when it comes to like obesity and gut health, Nutrition is obviously key, but when it comes to like reflux and gallstones and pancreatic cancer and colorectal cancer, nutrition has a huge impact on all these things that gastroenterologists see all day. And, just like the Band-Aid on a bullet wound, we would hand out like Protonics or Nexium, like candy. And I think we're seeing more and more that these antacids actually have repercussions down the line, right? We need acid to help break down food and for proper digestion and absorption, and just shutting down someone's acid completely because of acid reflux may not be the best thing long term. So these visits definitely require more nuanced conversations. So Byte MD, it's currently in the App Store in iOS and in the Android App Store. And right now it's kind of like a beta test version where you can have a conversation with an avatar. So currently the avatar is me, and you could say, okay, Byte MD, this is what I've had today and I'm having reflux. Why do you think I had acid reflux? So it's going to go over all the ingredients that you plugged in, and then it's going to give you insight. So we've trained this AI model, and it's going to say, okay, it looks like you ate, tomatoes at 10 o'clock last night. That can be a major trigger for reflux. Plus you ate late. Next time, maybe try to eat at 7 p.m. instead of 10. Or if you're having pizza, instead of doing something with tomatoes, maybe have like a white sauce instead of a red sauce. So the more information you feed it, the more feedback it can give you on GI related triggers. And then it feeds in a whole recommendation engine. So that's the app. And then we have a storefront, the bytemd.app. So we have blog articles located on there. And then if you're looking for healthy snacks on the go, high fiber, high protein, great for muscle health and gut health, then it will link to your Amazon store. So a lot of resources on our website as well.
Fantastic. Does that, as I was reading on it, the Byte MD, is that associated with your executive health programs as well, or is that purely with Prime Health?
Oh, so that's different. So the Byte MD is completely separate. It's something that I tell my patients about to use as far as like curated snacks and to talk to the avatar. But it's more so for people who aren't seeing me in clinic. So people who don't necessarily have the access to my expertise, but want to understand more about nutrition, gut health. And it is specific for people on GLP-1. So you could tell the avatar, I just injected my Zepbound and I'm having reflux. What do you think is a trigger for that? Now, it's not a doctor, right? It's not me behind it. We've just trained the model. So it's not going to tell you to adjust your dose or to skip a dose, but it's going to give you insights based on what data you feed it to say what are potential triggers on your symptoms.
Does it also have the ability to then try and set up a consultation with you?
No.
Okay.
Yeah. So for right now, it is completely separate. I think we're, throughout this process, it's been several years with the app. It's hard to find good developers. And I think, initially you want to do everything and then you just find more bugs. So right now we just want to be really good at just a couple of things and then expand from there.
Yeah. Okay. So then if we jump back into Prime Institute for a moment, do you have executive healthcare programs associated with it?
Yeah. So we're actually starting that in the next couple of months where we'll offer like an annual visit. And this actually was an impetus from one of my friends who works for General Electric. And he said, hey, I get like an executive health allotment every year and I'd love to see you. So he came in to see me. He spent an hour and a half with me and probably 2 hours with my sister talking about all things nutrition, exercise, gut health, sexual wellness. And when he was leaving, he was actually left with a vibrator to use with his wife. And he goes, I've never had this happen at any executive physical where my sexual wellness is going to be much better than it was when I came in. And that's the thing, right? I mean, we focus so much on just stress testing, which obviously is important, right? But we focus on the technology and getting the testing. But the reality for some of these really healthy folks is if they have a normal stress test every year and they're healthy, like, why don't we offer something else, right? What matters to them? What other quality of life concerns do they have? Whether that's improving their exercise performance, their sleep, their sexual health, like all of these things matter and we need to tailor it to the individual person.
Yeah. You're working on the health span most of the time, but it sounds like your company is also working on the lifespan. You want them to enjoy their life.
And the sex span. So we know that people who have a longer sex span are happier people and actually live longer. And I actually recorded a podcast this weekend with like the godfather of urology, and he was interviewing another urologist. And they were just talking about sex span. And someone made the comment like, when I'm in my 80s, I don't think I'll be thinking about sex. And my sister goes, if you're thinking about sex in your 80s, you're doing something good, right? Because we know that low libido is often a marker of something else going on in your health, right? Because stress, sleep disturbances, chronic conditions will definitely affect libido. So if you have someone in their 80s that has a great sexual life, like they're doing something right. Take notes.
I'll have to listen to my conversations a little bit more in regards to that. So from your business itself, who would you say is your ideal client that's out there that would be able to come in and see you and take advantage of your services?
Yeah, so I offer a couple things. I do colon cancer screening. So if someone is just looking for a colonoscopy, I do colonoscopies. My typical demographic is probably going to be someone between the ages of 40 and 65, someone who is ready to invest in their health and wellness, has the time to really invest in that. For people who are interested in weight loss medications, that's a big part of my practice. But the easiest part of my practice is writing a script. So if someone wants to come in and go on Wegovy and just wants a script and see me back in 6 months, that is not the sort of patient I'm looking for. I want someone who's really vesting in their health and ready to make, significant lifestyle changes. And that ranges from improving their sleep, their nutrition, making sure that they're doing their resistance training to prevent a lot of lean tissue losses. So they need to definitely invest the time in this program, because the reality is I can get anyone to lose weight on these medications. I'm not looking for goals 6 months from now. I'm looking 6 years, 16 years, 26 years from now, how to reduce someone's risk of frailty and fracture. And it's the decisions we make today, tomorrow, and the next that will influence how we spend the last decade of our life. So I'm in it for the long haul. So it's really patients who want to optimize their health. They can be normal weight, overweight, obese, underweight, just someone who's interested in learning more about their nutrition and optimizing their health. And then I also do perimenopause and menopause hormones, so hormone replacement therapy for women.
Okay. So for both of those conditions, I know that HRT just had the black box removed, which is fantastic for women. It's unfortunate it was there for as long as it was. But whether it's somebody in your GI practice or with the HRT that you're doing, how important is it for the mindset that your patients have when they come in to see you about them wanting to make the change?
So it's an interesting question in that, now that we've been in practice for a couple of years, I'd say the majority of patients that see me are friends and family of current patients. So that's great. So they've already had the discussion. They've seen the great results of their friend or family member. They've already kind of been given the down low and what the expectations are and what the program looks like. So typically when they call, they're ready to schedule, and so I wouldn't say it's cherry picking, but they kind of self-select. I post on social media. I don't necessarily spend a lot of money on search engine optimization because the random people are typically not calling in that are going to schedule with me. They're typically, those typically are not the patients that end up scheduling because we are a cash pay practice. So if someone doesn't know who I am or know my reputation or know someone who sees me, they are oftentimes not ready to invest, let's say, for the consultation. My sister's a little bit different. People find her from YouTube and podcasts because she sees kind of more complicated sexual things. For me, it's, the access to these GLP-1s is not as hard as it used to be. So if someone doesn't know who I am or what I'm about, then it's typically not the random person searching on YouTube.
Understood. Dr. Pearlman, in regards to your business, you have Prime Institute and you have Byte MD. What are the things that you're focusing on in those businesses right now?
I mean, it really aligns with what you do in your business. It's growth, so we initially started about 3 years ago. We are still a very lean team. It's me, it's my sister, and we have a virtual, basically assistant that takes the calls remotely. And then that's it. It's literally my sister and I are the only employees of the company. And then we just do, use consultants for accounting and bookkeeping and all those other kind of tasks that we're not experts in. But yeah, I think, the challenge is we are doctors. We are entrepreneurs now. We like to call ourselves doctorpreneurs, but we never took a single business course. And here we are starting our own medical practice on our own. It's figuring out, what does success look like, right? I mean, we've been successful so far, but if we continue to do exactly what we do now, 5 years from now, would we consider that success? Or how do we grow? We've had a bunch of people tell us, you should definitely scale. What my sister and I have realized is when you scale, you have to manage more people, and we don't like managing people. So that, therein lies the challenge, is finding really good people that will represent the company. Either it's, just adding more people to our local practice or expanding to other offices. there's a lot of ways that we can grow, and we're still trying to figure out what that looks like. And at what point does it make sense to hire, let's say, another physician? Are we at full capacity yet? Or we end up losing money if we hired someone at this point? Or do we need to hire a physician? Or would it make more sense to hire a nurse practitioner or a physician assistant? So these are all things that we're just trying to figure out. But we are expanding. We're adding the executive health program. So that will be a big addition. Last year, we had expanded to, I was offering the women's health, which was a new addition, and I got training in that. And then my sister had started treating the genitourinary syndrome of menopause and the sexual health for women, because when she initially started, she was solely only seeing men. So every year we kind of add on a new service line and expand in that regard. The next kind of wave of expansion would be probably hiring more personnel.
Okay.
Yeah.
It is, you either see more or charge more. That's really how it goes. It's not fun to do either.
Yeah.
I mean, it's fun to collect if you charge more, but it's also difficult. You've got to find that happy medium in between the patients that do want to see you and can afford to pay to see you. So I love how you have an app that eventually be more of a monetized system to be able to help practice and even more that are inside of there. So I know the app uses AI, but in your own practice, do you utilize a lot of AI?
We don't.
No?
I know we had met with a bunch of companies for like scribe services and things like that, but we're pretty low volume practice, right? So on a busy day, I'm seeing 8 patients. So it doesn't necessarily make sense to spend a couple $1,000s on a scribe service if it's easy enough for me to just type the notes, for each patient, because we're not seeing 30 patients in a day. So I know there's a lot of technology out there. I think at this point, the question is, at what point would it make sense to improve our efficiency?
Yeah. You can have more time to be in the gym or do fun outside in beautiful Coral Gables if you took that time. So I would love for you to share a success story or two of your practice and since you've been out in your own private practice, how you've changed some lives.
Yeah. So one of my early on patients, this was a couple years ago now, he had probably gained about 50 pounds over the years, and he's a successful lawyer. So he came to see me actually when I was seeing patients in Fort Lauderdale. And this guy had used to run like half marathons. So I ended up, getting him on a weight management program. He was doing very well on a GLP-1 medication. And we were noticing that he was losing muscle along the way, which, lean tissue loss is very common with any weight loss, not just GLP-1s, but diet and exercise and bariatric surgery. Any significant weight loss, people will tend to lose lean tissue. And so I checked his testosterone. It was definitely on the lower end. And this is actually where the mutual patient was born with my sister and I. So I referred him to my sister because I only do the hormones for women. My sister optimized his testosterone, and this guy started gaining muscle, losing visceral fat even faster, and ended up hitting PRs in marathons and half marathons. So he was the impetus, actually. Her and I got together and said, if we can do this for men, why can't we do it for women? Because I had no knowledge at all in hormone replacement therapy. And I was seeing so many middle-aged women come in, and they were having brain fog and hair loss and all these other symptoms and lack of motivation. And I thought, oh, they're probably just not eating enough protein, or maybe it's the GLP-1. And yes, you can definitely get side effects from GLP-1s, but I was missing the critical piece. They were perimenopausal, and I wasn't addressing the estrogen deficiency. So that's actually where we see our most successful patients and we're seeing this actually in more recent clinical trials. Women specifically who are on hormone replacement therapy and GLP-1s tend to do the best. So my practice that's just kind of how it came to be in just the patients we were seeing and listening to the stories of our patients. And then now we're looking at clinical trials, which we didn't have before. It's lagging in men. But I think they're actually looking at combination products of GLP-1s and testosterone to help with muscle loss. So we saw it clinically. Not a lot of data out there, but we're starting to recognize it more, which is pretty fascinating.
Yeah. So how do you, in your practice, because it's difficult for people to come in outside of a typical hospital clinical setting, how do you feel, Dr. Pearlman, that you are building trust with your patients for them to work with you to make life changes?
Yeah, I think it's just providing the stage for people to kind of share their story and their struggles and what they're looking for. It's, I think as physicians, it's been very paternalistic for, I think, a long time, and it really needs to be a shared discussion. So patients need to realize I have no agenda, right? I mean, I prescribe a lot of GLP-1s, but by no means does everyone leave my office on Ozempic, right? The whole goal is to figure out where are they starting from, what are their goals, what have they struggled with, and how can I be kind of a cheerleader in their journey and help guide them in the right direction. And then I offer them options and they, decide what they end up wanting to do. And I think the nice thing about providing access is people don't have to make the decision that day, right? They can say, let me think about it. Let me come back to you in a month and let's kind of see how I do over the next month. And then let's, make a game plan from there. So I think that's a big thing. Instead of us kind of dictating what the plan is, it's informed consent, providing the education, providing the tools, and then making it a shared discussion and ultimately giving the patient the decision to decide what they want to do.
Yeah. You're not pushing it. You know that it would be a better choice for them to make a better healthcare choice for themselves. Yeah. You're educating them and allowing them to make the choice themselves. And that's the best way to get a better result.
Yeah.
Yeah. So as we approach the end here, I know that we'll share your links to everything, but if somebody's interested in learning more about you, Prime Institute, Byte MD, how would you like them to reach out to you or find more information?
Yeah. So the easiest way is on both of the websites. So it's primeinstitute.us is our website. That's also our social media on Instagram. And then for Byte MD, it's bytemd.app. That's our website as well as our social media handle. So anyone interested in a consultation, the easiest way is to submit a consultation inquiry on our website, and that comes directly to our assistant who will contact you within 24 hours.
Okay, fantastic. And I'll make sure again to share those links for you. But last two questions. If there's one piece of advice you could give to anyone listening or watching to this to change their health in a positive way, what advice would that be?
I think it's all about progress over perfection, right? It's about making that next right decision. It's, if you look at a fancy watch and you look at all the rings on the watch or the gears, it's just about making one decision that pushes that first gear. And then once that first gear moves, that's going to move the second gear. I think too often we try to just change everything all at once. It may just be tomorrow for breakfast, I'm going to have a plain Greek yogurt with berries instead of a Yoplait yogurt, right? That one simple change. They are both yogurts. They both have sugar. One has natural sugar and more protein. One has high fructose corn syrup. So maybe that's the only change I make over the next week is change my daily breakfast. So it's those small decisions, making better choices, not always perfect ones.
Thank you. Not always perfect ones. That's good. I like that. It'll eventually become perfect with your help, but not at the start initially. So thank you for sharing that. Last question. You have Prime Institute. You're on the Prime Health podcast. What would your definition of Prime Health be?
I want to be doing what I do now when I'm 80, right? So I think the biggest thing is picturing what we want our life to be, decades from now, and then doing whatever we can today, tomorrow, and the next to maintain our VO2 max, our, cardiovascular health and our muscle health. I would say strong is the new skinny, right? We have to protect our muscle and bone, and movement is incredibly important. So moving our bodies on a daily basis, doing things that we enjoy, but protecting our muscle and bone, because when we have healthy bones and muscles, our brain is healthier, our heart is healthier, every single cell in our body is healthier. So I think, being able to move is so critically important. And that's really what defines, health for us when we're in our 70s, 80s, and 90s. It's reducing the risk of frailty and fracture and maintaining our independence until the day we die.
Yeah, I can appreciate that so much, knowing some elderly family members that I wish that they had stuck with that. You see, when you can see that frailty come about them, and then somebody their age or a little bit older than them actually is moving and out in the woods walking and enjoying life more. They're sitting at the dinner table at night. Both of those individuals, one enjoys their life just a little bit more than the other. And I think the process that you're telling people to go through and you take them through is important for them to do it.
Yeah, it's maintaining independence, I think. And that's through movement, through nutrition, through stress management, through, sleeping, at least 7 hours every night. All of these things make an impact on how those last 10 years are going to look.
Yeah. Sleeping 7 hours a night. I that's something I will work on. I don't do it. It's not purposeful. It just is the way it is. So I appreciate the share with that. So Dr. Pearlman, it's been a fantastic podcast for me. I always like them because I get to learn. You've got such an intriguing and interesting process of how you've gone through from being a personal trainer where you were in school to then becoming the MD, realizing that the medical scope and the medical field was in question, You took a huge leap of faith, you and your sister, starting your own practice with Prime Institute, and then developing something to help people when they may not be able to see you or they're miles away from you. Hey, you can have a conversation with our app, bytemd.app. You're able to help them with that. So the future of possibilities that your practice is offering people is fantastic. So I really appreciate that. For the viewers and listeners that are watching this, I would please ask that if there's just one person that you know of that could benefit from this, please share it. Of course, we would love you to help Dr. Pearlman grow her practice, but if she's in Florida, and if they're in Texas, they still need to talk to somebody there, and maybe they can do a consultation with Dr. Pearlman, but share this with somebody. It's really, really important. We need to be healthier as the world changes. People are becoming more aware of that, but it's really important that we work on that. So I always say, from a selfish perspective, please do subscribe to the Prime Health Podcast. We love to have this message shared by more people. So until next time, remember that true wellness is a journey we are all on together. Whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So please do stay committed to your Prime Health journey. And again, Dr. Pearlman, thank you so very much for being a guest on the Prime Health Podcast.
Thank you for having me.